Renee and Tiffany, and if you'll notice, it's just Tiffany because Renee is under the weather. So we have Tiffany, I think it's Smith, is that right?
Yes, that is correct.
And she is a project coordinator for SHARE. So we're delighted to have her with all of her knowledge and information with us.
Thank you.
And we also have Karen Kolb. She's a manager of senior services for the city and has lots of information for us. In-home support programs for the older adults, caregiver supports, legal services. She knows just a lot. So we're most happy to have both of them with us, giving us their information and answering our questions. So I'm going to turn it over to you two. Go ahead.
All right, Karen, if you're ready, you can go ahead.
Sure.
I'm going to mute everyone, and then we'll have Q&A at the end of her presentation. So feel free to either raise your hand or post your questions in the chat, and I'll monitor those.
Okay, thanks, Tiffany. And just to be clear, because there was some changes at the last minute, Miss Renee was going to present some, and she's under the weather. So Renee is not here. And Tiffany, you're running technology. Is that right?
Yeah. I'm going to press mute all now. So if you need to unmute yourself to talk, just go ahead.
Okay, I'll do that. But before you start, my colleague, Dr. Victoria Russo, Supervisor of Family and Sports Services, is here presenting with me as well.
Oh, wonderful.
So before you mute us, if I can just let everyone know, if you have questions, I think putting them in the chat's a great idea, or just writing them down so we can talk about them afterward. So the goal of this session is to provide an overview of Medicare. And I know there's an interest in particular, Medicare Part C and, or Medicare Advantage as it's called. And then we will provide kind of a general overview of Medicare. And then we're going to talk about some of the programs to help to support folks with paying for some of the Medicare services. So Tiffany, if you want to go ahead and mute everyone except Dr. Victoria Russo and I, or you want us to unmute ourselves?
Yeah, I'm going to press mute everyone. And then once you're ready, you can go unmute. Okay.
All right, cool. And I'll share my screen.
Okay.
And I will invite you, Tiffany, to keep an eye on the chat if you don't mind doing that. Yes. Okay, I did this once. All right. Okay. How about a show of a wave or a thumbs up? Can everybody see the screen? There shouldn't be anything on the side. It should just be the front presentation. And then I think I have it set that there's subtitles on the bottom. Can y'all see that? Yep. Okay. I see some nodding. Wonderful. Well, thanks for coming today. And Victoria, hopefully you've unmuted yourself. We had a bit of a change as I shared that Renee was unable to present. So we've done a pivot. And our goal today is really to just provide a brief overview of open enrollment. Excuse me. I feel like I'm going to sneeze, so it's going to come on in just a moment, so forgive me. And my colleague, Dr. Victoria Russo, and I will field your questions. The goal of the presentation today, as I said, is not so much to talk about your own individual cases. And we are going to provide options for having your own individual cases supported and discussed, because frequently people don't want to talk about their own personal circumstances in a group setting. So we have one-on-one counseling for that. But we can do today is ask and respond to general questions. And we'll go from there. Hey, excuse me one moment. I'm going to sneeze at some point, so I'll just say, excuse me, preemptively. All right, so, and let's go ahead and get started. I'm Karen Kolb. I'm the manager of senior services at the city of Chicago, and my colleague, Victoria Russo, oversees our Alzheimer's and dementia grant through the Administration for Community Living. And she's also supervising some new initiatives for us. So we're very pleased to talk about. She's a certified senior health insurance program counselor, and I'm a supervisor of the program. Okay, so going to our next slide. So what we're going to talk about today, and do you see the next slide there? I don't see it on my screen. Hold on. All right, hold on. Brief technical issue here. All right, I am. Can you see my screen? Not yet.
Yeah, I see your screen, but it hasn't advanced the next one yet.
Yeah, it's not advancing for some reason. I have 3 screens, so forgive my, I'm putting it on my first screen. Can you see?
Yeah, I see the PowerPoint, and you're highlighting over the slide 2 deck in your deck.
All right, so I'm going to do this. I'm going to close this out.
Okay.
We're going to improvise here.
Okay.
Because this is in a presentation, but can you all see that okay?
Yes.
Okay. I'm going to just do it this way because I can't quite get it to view the way I'd like to on my, I see it as a presentation on my regular screen, but we'll go with this for now. Okay. So what we're going to talk about today really is a focus on Medicare. And as I said, the health benefit programs that are available to individuals age 60 and better, and also those who have health conditions that may enable them to access Medicare earlier in their lives. So before we get started, we're going to go ahead and just give you a brief overview of the Chicago Department of Family and Sports Services. And we are the 3rd largest department within the city of Chicago, and we're a lifelong organization. So we start at youth services, children's services, go to youth services. We have a specialized division for domestic violence, workforce, and you may see our community centers all across the city. We have services for individuals who are without housing. And then we have our human services delivery. And we, of course, are the senior services division. And to that end, what we do in senior services is focus really on individuals age 60 and better. But as far as CDFSS, or the Chicago Department of Family and Sports Services, what we really do is work through community partners. We have a lot of we have over 1,600 contracts with community-based organizations, and we partner with Chicago's nonprofit organizations to help to deliver services to people of all ages. And so to that end, you can see our mission and priorities below. Senior Services is what's called the Area Agency on Aging for the city of Chicago. And what that means is that we are the entity that is responsible for delivering federally based programs within the city of Chicago. Within the state of Illinois, there are 13 what's called area agencies on aging. And as the city of Chicago, we serve Chicago residents only. And we are really focused on older people, 60 and better, caregivers of those individuals, and then also providing resources to other programs that are for people who are younger with disabilities. And in particular, that's our Ombudsman program, which oversees programs for, it oversees residential care facilities where people with disabilities live. So you could think of nursing homes, assisted living, and then some of the specialized residential care facilities that are available. And then also adult protective services, which ensures that people aren't taken advantage of. As the area agency on aging, we plan, coordinate, and advocate and fund services for older adults. We have a focus, while we serve everyone, we do have a focus on those with the greatest social need, the greatest economic needs, those who live alone or who are at risk of institutionalization. So this is kind of an explanation of how the money comes. It starts federally and then goes down to the Administration for Community Living, then goes to the state, and then moves locally so that programs really reflect local needs and interests. So you all know a lot about growing older in Chicago because you do it every day. But as you think about older adults in Chicago overall, what we know is of about the 450 approaching 500,000 older adults in Chicago. About 16% of those live below the federal poverty line, and 25%, so 1 in 4, live in areas with economic hardship. And so we really are committed to helping people across the economic spectrum across the city of Chicago. And to that end, in 2012, Chicago was named an age-friendly city. And there's been many community-based initiatives like Chicago Hyde Park Village that have taken root to help people age well in the setting of their choice. So we offer at the Department of Family and Support Services, through our area agency on aging, a number of services that are at low, they're almost all at no cost. You can opt to contribute to some of those services, but you do not have to. And we are going to talk specifically today about Medicare, but I did want to let you know that we offer a variety of other services like you see on this slide: home delivered meals, free chore services. If you have someone in the village, or you yourself need assistance during a transition with someone coming to help you at home, or you have a big project, maybe you need a room cleaned out, maybe you're going to move rooms in your house, maybe you need to move some of your items that you've had a long time. We have a heavy duty chore service that can come and help with that at no cost. Of course, we have caregiver programs. We have legal services for people age 60 and better, where you can get any range of assistance there. So that can be anything from helping to have a will put together, or helping to have healthcare powers of attorney or finance if you're taken advantage of, if you need to have any real type of legal assistance. We have legal services. Again, I talked about adult protective services. We also have well-being checks for all Chicagoans in the community. And we have specialized assessments for older people to help connect you to services. And then we also have a case management program that can help people who are having challenges with certain issues, or maybe challenges living alone. We spoke about the Ombudsman program. We have some wonderful volunteer programs, including foster grandparents who go into schools and work with children at CPS schools. We have senior companion volunteer program where people are matched with an older adult, and they go and work with them on any variety of things, from reading together, assisting at home, just really providing some social interaction. We have some wonderful programs Victoria's going to talk about a little later, designed to reduce social isolation. We also have some training programs for our Alzheimer's disease. We have brain health. We have caregiver support programs, and then also our senior centers. And our main gateway to services where you would either call or you can send an email is through our information and assistance line. And you'll hear me saying to call INA or information and assistance a lot today. The phone number is 312-744-4016. Or you will see that you can send an email, which is easier for some folks. And there are folks that will answer the phone and will help connect you to the resources that you need.
Oh.
So today we're going to talk about information and assistance and the support that they can provide with benefits enrollment. And so our counselors at the INA at room 100 of City Hall, which is where they're located, are trained to help people to access resources, both federal resources and state and local resources. And in particular, they do a lot of support with people gaining access to the license plate discount, the bus passes and the reduced fare bus passes, the senior health insurance program, and also the senior health assistance program. So the information and assistance has people who answer the phone who are trained to help people who are Medicare beneficiaries, their caregivers, and others to talk about Medicare, to talk about your individual plans, to talk about the supplements that you might have, or a Medigap policy, to talk about Medicare Advantage or Medicare HMOs. And they can also provide some support around long-term care insurance. Not as many people have long-term care insurance, but they can provide some initial support to you. And of course, right now, you may have received notification by a lot of mailers coming to you and phone calls and emails that it is open enrollment period. And this is the special time of year where you can change your Medicare program, your Medicare programs that you use, and you can change your drug plan. And so this period runs from October 15th to December 7th. And because of that, there's often a lot of outreach commercials that happens during this period. Now, the charge was, and I know Renee was going to talk about this, but of course we're happy to do it, kind of a broad overview of Medicare. So there are many parts to Medicare. There's Medicare Part A, which is your hospital insurance and more. And we'll get more in detail on this in the following slides as we go. Medicare Part B, Medicare Part C, which is your Medicare Advantage plans or your Medicare HMOs. And it's a little bit tricky because sometimes those include medications. And then Medicare Part D is a standalone drug program. And then there's also these Medicare or Medigap plans. And sometimes those are called supplemental insurance plans. And those are when you have Medicare Part A and Part B, and you choose to have an additional addition to that. And I'll go over this next slide, and then Victoria, we'll go ahead and switch over to you. So sometimes rather than seeing names, it's good to have a little bit of a roadmap, if you will. And so the purpose of this slide is to lay out, there's two different pathways that you can take when you choose Medicare. And many of you are thinking, Karen, I know this, I've had Medicare for 20 years. But bear with us as you're thinking about, is there a change I'd like to make? Or maybe just Medicare is interesting and you want to just review it. Medicare, original Medicare is of course the Part A and Part B. Now, everybody automatically gets Part A when you have Social Security. That is at no cost. You are billed monthly for Part B through your Social Security. It's usually taken right out. And if you don't pay your Medicare Part B from the beginning, or you neglect to select that part, you can pay a penalty. So we always want to make sure people are aware of the Medicare Part B system, because of course, while you may qualify for Medicare because you turned 65, you might delay your Social Security payments. And since Medicare Part B is taken out of your Social Security, there's an opportunity for some errors there. So you want to make sure everybody's always on Part B. So if you have Medicare Part A and Part B, you then want to decide if you have drug coverage. And D stands for drug. And then you would also make a decision about if you want supplemental coverage. And the supplemental coverage covers things like coinsurance, copays, and allows for broader coverage at usually no cost. Okay, so that's the column on the left. The column on the right is a Medicare Advantage plan. And these plans have gotten more popular in recent years because people like the idea of, I don't have to get sick to take advantage of some of the programs. So, and by that, I mean, when you have a Medigap policy or you have Medicare Part D, you might not take any medications, or you might not really get sick to the degree that you actually take advantage of your Medigap policy or that supplemental coverage. So, whereas with Medicare Part C, it offers benefits that are not covered under traditional Medicare. And so people are able to take advantage of those right away rather than having to get sick to take care of them. So we'll go more into that, but I'll give you one example before we go on. Sometimes people want glasses. Of course, most people have some type of difficulties or vision impairment as they grow older. And traditional Medicare does not cover eyeglasses. It will cover the physician, but it will not cover the eyeglasses. Whereas Medicare Part C has an allowance for eyeglasses. And so oftentimes people say, I want to take advantage of benefits now and ensure that I have more comprehensive coverage now that I can take advantage of. So there's differences. Let's go ahead and move on. Do you want to go ahead and cover the next set of slides, Victoria, and I'll advance it as you'd like me to?
All right, sounds good. Well, as Karen mentioned, Medicare Part A is something that's included, and it covers hospitalization, and you get so many days for every period that you have a new hospitalization. And so one of the things people don't realize is if they go into the hospital, that starts a new period, and then you have to be out of the hospital for a period of time. And if you wind up, like, let's say you're only out of the hospital a week and then you have to go back, it's still that original first hospitalization. But what's nice about Medicare Part A is that they also cover skilled nursing facilities and home health care if needed in order to recover from the initial hospitalization. And also hospice care is an option under that original first hospitalization. So with Medicare Part A, keep in mind it is designed to handle acute illnesses. So it will not cover like skilled nursing care indefinitely. It's really designed to help you recover from an acute episode or an illness that caused you to be hospitalized. So you only have a few weeks in a skilled nursing facility, and beyond 100 days, it won't cover. Okay, under, can you advance to Part B? Part B is the physician care. And that's the main thing that you get under Part B. A lot of people look at it as the physician services, but it also will cover the durable medical equipment and supplies that are needed, especially if you're receiving some home care. It covers home health care if it's not covered under Part A, if there's like a requirement that you have a visiting nurse come in and help you with your diabetes or something. This would be covered under Part B. It covers lab fees and emergency room and urgent care needs, as well as the ambulance service. Part B is what you pay the Medicare premium for. Okay, Part C. As Karen mentioned, Part C is known as Medicare Advantage, and it's usually a managed care situation or an HMO. With the managed care, they're bundling the Part A, physician services, and the Part B, and often adding additional services in that bundle, like the vision care, potentially dental care, things along those lines. Normally, they are looking at keeping you within a certain medical network. So it's a good idea if you're entertaining the Part C to call the SHIP counselor and let them know where your service area is, what are the doctors in that area, who's your doctor. You would want to research and make sure that the doctors you want to go to or their equivalents are also covered by the Part C managed care program. Thank you. And then Part D is the prescription drug coverage. And this one is optional. However, if you don't choose it when you're 65, and a lot of people don't need many medicines when they're 65, so they figure they don't want to spend the extra money for Part D. What happens is when they do need it later on, there's a penalty, and the penalty gets added to their monthly premium forever, as long as they have it. So it may not be worthwhile to avoid signing up for Part D when you're 65. It may be better to choose a very inexpensive Part D program or plan that you, when you first turn 65, and then if your needs change, you can choose a different, more extensive plan later on. But the Part D coverage changes, not the coverage that Medicare provides, but the coverage that the health insurance, which drugs are under it, that may change on an annual basis. So it's a good idea to call the SHIP counselor every year, or you could do it yourself on Medicare.gov and look at, are the medications that you need still covered by your health insurance? And if not, which health insurance of the Part D plans in your area do cover those drugs? I've used it with my mom and saved a whole lot. Every year, just automatically check up to make sure that the current medications are on that list of medicines the particular drug insurance covers. Okay, on to that. So with the drug part, this Part D, most Part C Medicare Advantage plans include medications If they don't, you can get the additional Part D drug plan for that. It depends on which one you go with. Many of them include it, not all of them. So, okay. One of the things that we wanted to cover a little bit separately to get more detailed about was the benefits under the physician care. Okay, there are preventive services a lot of people don't take advantage of. So we wanted to list these here so that you could see you're allowed a doctor visit, a wellness check, as soon as you sign up for Medicare. Your very first visit to the doctor, it could be just for a checkup. How am I doing? That's the Welcome to Medicare visit. There's also an annual visit that you're allowed every year just as a checkup. You don't have to have some type of illness in order to go see the doctor. And many of these screenings are included on that. Glaucoma screening, depression screening, diabetes screening. So it's a good idea to speak with your doctor and make sure that you have been keeping up with your health and had all of these included programs, screenings at no cost too. Okay, next. Okay. There's an additional program offered by Social Security, or it's at least administered through the Social Security office to be more exact, that's known as Extra Help or the Low Income Subsidy. And this will help you pay for prescription drugs as well. It's designed for people who are low income because the way that the Part D is covered, there's a certain amount of copay to begin with. And then after like $2,000 or something is spent by the insurance company, then there's much more that the person has to cover themselves, also known as like a donut hole, and then it goes back to being covered. So this will help for people when it's their turn to pay a little bit more of the share of their prescription drugs if they have a lot of prescriptions and have partly through the year had an increase. So they could look at Medicare, the low income subsidy. It's a good idea to talk to the SHIP counselor again, specifics about somebody's situation to find out if they qualify for this. Another good benefit is through Medicaid. Now, the difference between Medicare and Medicaid, Medicare is something that you get through like your Social Security, and it's a federal program. Medicaid is both a state and federal program, and some states are more generous than others. They all have to meet the federal guidelines, but then some states can be more generous, and Illinois is one of the more generous ones that says that they will help cover as if somebody has a certain income, but also higher medical bills. So other places with other states, not all of them, but some will say, okay, there's just a hard and fast line. If you're over this income limit, we're not going to cover you with Medicaid. But in Illinois, you have some options. Can I have the slide after this?
Sure.
Anyway, with Medicaid, there is the Medicare Savings Program that Medicaid helps Medicare by covering the premiums, the deductibles, and some of the co-insurance. So it's to make it so that that monthly premium amount isn't hard for somebody. And it's, again, one of those programs where to see if you meet the income qualifications, it's a good idea to check with the SHIP counselor about your specific situation. So it's really making sure that people can maintain their Medicare benefits. and that it's not becoming too difficult to pay that monthly amount. Okay, next one. Oh, okay. Well, there are a few other, if you're interested in the Medicaid and the programs under that, especially like whether you would meet the income qualifications or if you have the medical bills that are a little bit high and what are the criteria for the spend down with that. Your SHIP counselor can help you. They can also help you with another program called Extra Help. And that will let you more or less pay enough in your medical bills so that if you get above a certain threshold, then Medicaid can kick in. But again, the SHIP counseling program is a great way to look at your specifics and what your needs are. Then we didn't really cover this too much, but I also wanted to let you know that under the traditional Medicare, when you're using Part A, Part B, and Part D, you can also apply for a supplemental Medigap plan. And those Medigap plans, they have a whole variety of options that you can choose from, but these are standardized. They're federally standardized what's included with each Medigap plan. And it's sometimes confusing because they chose to use letters to identify the different choices under Medigap. And I find it confusing because there are a variety of Medicare, Part A, Part B, Part D, right? And then when you get to that last box under supplemental, they also give you Plan A, Plan B, okay? And some of those are more detailed than others, and that's always an extra cost for people. So, but it really does wind up saving people money. They pay the premium for the Medigap policy, and then depending on what their needs are, some of people need more care, and they select a plan under the Medigap policy that might be a little bit more expensive, but because it's covering all their needs, in the long run winds up being less expensive for them because the insurance is covering it. So it's a good idea every year to also look at your Medigap policy. Any questions?
People can put their questions in the chat, or they certainly can unmute, I think. So you might ask yourself, well, okay, I understand Medicare a little bit more now. And I know people specifically had questions about Part C coverage or the Medicare Advantage plan. So if you put your questions in the chat or come off mute, we're happy to talk to you about that. And I actually think Victoria has to sign off a little bit early. But I'm happy.
Thank you very much.
You're welcome. I'm happy to answer questions about that. But what you want to do again is call our information and assistance line, the benefits access, and talk to people. 312-744-4016 or email. Because then you can get connected with someone who can talk to you specifically about your individual, pardon me, situation. So they can talk to you about your medications. They can talk to you about, pardon me, your the coverage that you have, and where are some of the shortfalls and where is it stronger. And I see a question in the chat from Sarah. Is there a problem with changing Medigap plans if you have expensive pre-existing conditions? My understanding about Medigap policies is that any problems around pre-existing conditions were taken away when Obamacare came in. So you should not have concerns about pre-existing conditions. However, calling and talk to someone and getting individual counseling is the best way to really figure out your individual situation. So, you know, Humana has a Medigap policy or supplemental insurance. AARP has one. Cigna has one. They vary by state. And so as you are an Illinois resident, you should only be looking at information from Illinois. So that's kind of something to always be a little bit wary of.
Susan also has a question here.
Go ahead, Susan.
She said, I understand that if one continues working and using private insurance after 65, non-enrollment penalties are waived. What happens when this enrollment and coverage during the year, say in July, so one has missed the open enrollment period?
Yep. So that's a great question, Susan, and one we definitely want to talk about. So the reality is today is that people are working longer. And so what happens is, let's take, for example, if you're on faculty at a Hyde Park employer like University of Chicago. So what would happen is you would become eligible for Medicare at age 65, but you want to keep your existing coverage, which is being paid for out of your paycheck from the university. And so what you would do is you would enroll, but you would have deferred program enrollment. So basically your existing insurance, so let's say you have the Blue Cross Blue Shield plan, your University of Chicago is the insurer of first, that's the first line insurance. And then your Medicare insurance would come before it. You would have deferred enrollment for Part B and also deferred enrollment for Part D, like David. Let me repeat that because they sound alike. So you would be involved, you would be automatically enrolled. Everybody's enrolled in Medicare Part A. Your preferred insurer, however, will be your existing insurance. You still need to enroll, you still need to sign up. You have about 3 months before to sign up for Medicare. And then what you say is that you still have employer coverage. And so that employer coverage takes over the Part B like boy and the Part D like David. And so you do not have to sign up for those. And then what happens is when you opt to stop working, or if you are, downsized or something like that, then you have, that's a status changing event and you have a certain number of months to sign back up. Does that make sense to you?
Yeah. Thank you.
Absolutely. My pleasure. It can be very challenging. That's why we always encourage people, talk to someone one-on-one, because you don't want to take this broad guidance and assume it always applies to you.
Well, in fact, we do get a letter every year from the university that verifies that we have insurance, and this is important, I assume, for when we do enroll.
Yeah. Also, I think, and I'm using the university because I'm pretty familiar with the way that their insurance structure is done, though it changes. They offer you, maybe your employer would pay for a Medicare HMO. And so you can opt into that plan, or maybe they pay a Medigap policy for you or Medicare supplemental insurance for you as a benefit. And so you really just need to, it's very hard to figure out, even for people that work in the field of aging. There's a lot of training that goes into this annually to help to navigate these shifts that are made. So really, I think that trying as much as you can to reach out for qualified assistance is helpful. And I did talk to Lucas actually about, we have a quite robust training program about Medicare, where Chicago Hyde Park Village could actually have a couple people trained as Medicare counselors so that you all could offer that kind of ongoing support throughout the year. That's also something I want to offer to you. If this sounds interesting and you're not, it's like a puzzle, right? You got to figure out each individual person's path. And so if that sounds something interesting, or you know someone that might be interested in this, we can talk to them and help get them trained. I see a question in
I have a question.
Yes.
I tried to post it on chat, but I must have hit the wrong.
did. Let's see. It looks like, hold on. I see something for Maureen.
Yeah.
What?
Let me see. I see something from Carolyn.
No, that's from Joe Marlin.
Here. So this is Eric.
Eric had a comment.
No, I'm Joe Marlin.
Okay, let me see. I'm looking through
I wanted you to say more about the disadvantages to the Advantage plan, because for some people it poses problems, and I think that ought to be discussed a little more, particularly apparently for people who have more major health conditions. Because I heard of a horror story recently of someone who was on Advantage and needed some diagnostic or treatment procedure out of network, and it took them 6 months to get approval. Whether that disadvantaged them in their future health, I don't know, but it certainly raised their anxiety level and their anger level for quite a while, months. So it is an issue, and I think it ought to be discussed a little bit.
Well, thank you for bringing that up, Joe.
And before you go there, Carolyn actually was in line before Joe.
Oh, so, I'm sorry, but
Joe, answer Joe and then go to Carolyn.
Okay. And just to let you know, we could have day-long trainings about Medicare easily. It's pretty complex. But I'm glad you bring up Part C, and I think it's really important to consider these choices, because you get a lot of good advertising and things on TV sent to you. And Medicare Part C, when it all comes down to it, is a Medicare HMO, right? So they get a fixed amount or a capitated amount per member to manage your care. That means that you have to use their doctors, which some people don't always realize. And it means also that they can more readily tell you, no, we're not going to pay for that procedure. Or there's a wait list, just like you said, or that's out of network, so it's going to cost significantly more money. And the reality is, with Medicare, traditional Medicare, you can go wherever you want. You can see whomever you choose. They have to take Medicare, which some doctors will not take. Most do, but some will not. You can go to any hospital. You can go to any urgent care or emergency room. Whereas with a health management organization or an HMO, you have to go to their facilities. And they vary. So I think, Joe, you bring up a really important question. And I tried to kind of stimulate your thinking a little bit about this.
Doctor, this is Carolyn. My question.
Carolyn, just 1 second. Let me finish my thought, if you don't mind.
Okay.
So, Joe, I think that I tried to allude to this a little bit. Some people want their benefits immediately. And the hook with Medicare Part C is they may cover transportation, they may cover vision, they may have a coupon or benefit towards hearing aids. And for some people, those cost savings are crucial. But when it comes to a big hospitalization or long-term, if you have bed fall and break your hip, then you're going to need a lot of skilled nursing and rehab. And those things are also capitated. And so my thinking in general, and this is not my City of Chicago hat, I'm going to put on my aging expert hat. My advice that I usually tell people is, if you can afford regular Medicare, and a Medicare supplemental policy, that's oftentimes a good way to go if you have significant expenses. Okay. Does that make sense, Joe?
Yes, okay, thank you very much.
Of course. And now I believe Carolyn, I apologize. Can we go to your question now?
Actually, my question falls under what you just answered, because it does cover things that are going to be more of an extension, such as the acute, subacute care in a facility or home therapy and so forth and so on. And it's been my experience in the past 2 years, unfortunately having an Advantage program, that even though you apply to the insurance company and it supposedly goes to an outside review board, I have never been granted any kind of extension, and I am over 80 and live alone.
Yep.
So I have changed. I am personally, I'm going to put this out. I have dropped or will be dropping the Advantage through a former employer and going to a more traditional mode.
Right. And I would strongly think, I would recommend that you look at the expense of a supplemental coverage.
They actually come out within a couple of dollars, pretty much.
Then, yeah, because here's what I've seen. I've seen so many people who go to the hospital and they say, oh, it's covered. And then they get a gigantic bill for the co-insurance. Or they get, you know, if they just have Part A and Part B, they don't have a supplemental. You can get a big bill for co-insurance. You can have to go to physical therapy and pay $30 a treatment as a copay. And if you have a supplemental program, a supplemental policy, what that does is that covers that additional expense. Now, the tricky part is, and this is why I always tell people, call the city, call the state, because you will hear, oh, come to this informational talk about Medicare, and it can be someone who sells policies. And they're not always very clear about the fact that they sell policies. And so I just want you guys to be careful and know that there are, either at a state level, at a federal level, or through the city of Chicago, we have resources that are not influenced in any way, shape, or form by sales or anything like that. We have folks who are trained who can help you to figure out your situation without any type of influence outside of that. So Carolyn, thank you for bringing that up. And I'm glad what we said kind of was, you had a similar experience. So Eric says, Medigap policies can deny you based on your condition. A Medicare Advantage cannot. So Eric, that is, I could be wrong. It's not, wouldn't be the first time. It will not be the last. My understanding was that Medigap policies could no longer look at pre-existing conditions when Obamacare was passed.
Actually, Karen, the exception to that is it's only during the initial phase of getting the Medicare supplement policy during what's called the guaranteed issue phase. 12 months thereafter, they can deny you if you decide to go to a different Medicare supplement policy. They can deny you based on your condition or increase the charges.
You can increase charges, and the Medigap policies, they will frequently increase, you know, the cost will definitely increase. It's not that you're going to be locked in, just like your Medicare cost increases. I'm going to look into this further, Eric, and can provide some additional information. Thank you for bringing that to my attention. I definitely want to look at that. The devil is in the details with this. The other trick I'm going to tell you is, if you all ever call Medicare, make sure that you get the information for the transcription of your conversation, because everything is recorded. The guidance that they give you is recorded. You want to write it down, the date that you called, the time that you called, the name of the person you spoke with, but they will also give you a identifying number for the call. And they will go back 8 years later and review what that person told you. So please make sure that you are judicious with taking your notes when you talk to those folks.
That's good to know.
Yeah, I think we've hit our time.
Kelly has
I have a question.
There's some questions there still in the
Okay.
chat.
Let's go to Nina, then I'll do the questions in the chat.
Thank you. I was wondering about the Advantage Care, if all of the plans and all of the insurance companies have the same issues.
No.
Have you found that some of them are better than others?
I do not know. It's an excellent question. And I think it's so hard, Miss Nina, because people have individual health conditions and they have different needs out of their insurance.
Well, that's true, but I like to think about the fact that even if I'm fine now, I might not be fine in a few years.
Sure.
And I want to be insured for anything. So I'm not going to buy insurance. I'm not going to decide on insurance based on what I don't have now.
Right. Right.
That didn't come out right, but.
Well, it's kind of like when you have an insurance policy on your home. You hope you don't have to use it. You hope you're not going to have rising water in your home, but it happens. And so I understand you want to have kind of the broadest coverage that you can that's going to reflect your needs today, but also into the future.
Well, so one of the things that was said was depending on how big your problems are, you might want to go with the original Medicare instead of the Advantage plans. I personally don't want to do that. I want to get a plan that will work whatever happens to me.
Mm-hmm.
So that's why I did talk with somebody at Humana, and he made it, this is why I'm here today. He made it sound very, very magically good. But he said that one of the reasons Humana can do some of the things they do is because they do a lot of the paperwork for Medicare. So the way he put it is, the customer or client or whatever doesn't get charged for certain things because Medicare is paying Humana for those things. Do you know anything about that?
Well, so the way that health maintenance organizations or HMOs like Humana are put together is you receive X number of dollars per client or per patient per month, whether they use it or not. And so let's just say they're paid $500 a month for you, Miss Nina, every year. So they have $6,000 and they get $6,000 whether or not you use their services. Whereas with straight Medicare is billed, they bill upon usage.
Got it.
So I've never heard that Humana does paperwork for the government.
That's what
that's kind of, I mean, I think everybody does paperwork to get Medicare. And in my experience, most of the people that work for companies are often convinced that their policy is the best. I think that's why it's important to call someone who has no interest or is not employed by or doesn't have a paycheck written by the company that you're talking to them about.
Yeah. Well, I appreciate all of this.
Yeah, it's tough.
I didn't realize it was an HMO. And
it is.
I already have a fear of HMOs, so this was very useful for me.
It's hard. So they're called Medicare Advantage plans.
Yeah.
They're called, there's one called Oak Street Health, and they have a great program. They provide transportation. Some people really, really like them, but they don't always tell people you're not going to get to use the doctor you want. They don't always tell people.
Well, they didn't tell me that, but I asked that, and he looked it up, and actually anything I would have wanted was available in Chicago. Yep. But this idea that I have had clients of my own who had medical needs, urgent medical needs, and were part of an HMO and couldn't get what they needed. And that was terrible. So I'm sold on what you're saying.
Well, and I think calling the phone number is good. Let's see, Carolyn's commenting that you'll get a salesperson from that company. Yep. Okay, let's see. I see Ellie. Can the DVSS recommend specific policies? I think you mean DFSS, which is Department of Family and Sport Services. No, we absolutely cannot. What we do is we sit down and we have people who are volunteers. We have paid staff who sit down with people, look at the medical conditions that they have, look at their resources, and help them with their individual situation. We would never recommend a certain policy. We just can't. That's not within the rules. We'll look at your individual purposes and we will together come to some options for you and you'll make your choices.
Thank you.
Yeah, sure. I see Carol has her hand up.
Which Carol?
Carol Cross.
That's me. Is what you're talking about the same thing as a supplementary policy? I'm getting real confused.
Okay, I thank you for your question. So the supplemental policy is the Medigap plan. Okay.
I still don't understand, but other words.
Okay. I'm going to go down here. So you only need a supplemental plan. You can choose to have it or not choose to have it. So if you have traditional Medicare, original Medicare, which is this group here on the left, original Medicare, you will have Part A and Part B. And then you will have to choose a drug plan. And I want to reiterate, you have to choose a drug plan. Okay. If you choose to, you can also have an additional Medicare supplemental policy or a Medigap policy, they're also called. Now, the goal of that is to provide wraparound coverage so that you pay less for your co-pays, for your co-insurance, and it extends some of the, and expands some of the coverage.
Well, my policy covers everything. I don't pay for anything. And it also, I was hospitalized in a hospital in Mexico, and Medicare doesn't pay anything, but my supplementary policy pays 70%. So if people travel, maybe they want to look into that.
That's a good idea. And if you, yep, I'm sorry.
Well, at my age, I don't know what's going to happen.
Yep.
So I don't know why someone doesn't have a supplementary policy, because, you know, there are ways you can do it. You can get it with a copay. It's this much, this much, or this much, and nothing. There are different price ranges. And in the long run, it pays, actually it pays, I think, to have one that covers everything, because you do not know what's going to happen. I certainly didn't. So I'm sorry, I'm very confused though. I was very confused about my supplementary plan. Does that take the place of, what are we talking about? Take the place of Advantage, Medicare Advantage?
You would not have Medicare Advantage if you had a
would I need it?
No, you do not.
And also
you are taken care of. If you have Medicare A, Medicare B, Medicare D, you have drug coverage, right? And a supplemental plan. That's kind of the Cadillac of insurance coverage. That's full coverage.
I don't know anyone who doesn't have a supplementary plan. It seems like one
thing that's important to remember about supplemental plans is they can cost a couple $1,000s, sometimes more. And you can pay that monthly, or you can pay that quarterly, or you can pay that annually. But sometimes that additional money is tough for people. And so that's certainly a consideration. I don't want to disregard that.
Well, in the long run, they may need it, have needed it.
That's right. They may.
As you get older, you don't know. You
Yep.
could fall and break your hip.
And also, I want to stress that you can call our number, 312-744-4016, all year and talk about Medicare. You don't only have to do it about open enrollment during open enrollment. The thing is that the changes this is the time to make your changes. But if you have changes about your plan, questions about your plan, or you're thinking about changing and you just want to talk to someone, you can talk to someone and get that resolved. And I see that my peer, Mary Bloom, is on the call. And Mary, maybe you want to come off mute and see if you have anything else to add. Mary is a SHIP counselor and she oversees our information and assistance team. She's the director there, and it has fantastic knowledge in this area. Mary, is there anything you'd like to say to the group?
Hello, everybody. And I would just really like to encourage people to take advantage of open enrollment, because things change the next year. And during open enrollment, we know the prices for next year. So if you're on medications, we can check up your plan D to see if the medicines that you're taking, the prices on your plan are going to be jacked up next year or not. Because some people get complacent. They like the one they had. They've been real happy with it. So they're like, oh, I'm just not going to change. But then come January 1 and you go to get your medicines and you may find they're more expensive. So by coming in for open enrollment, we can help avoid that and make sure you're getting the best plan for your needs. So I just really encourage doing open enrollment with a SHIP counselor.
And Mary, what do people need when they come for those appointments with the SHIP counselors?
It's very important to bring your Medicare card and then a list of your medications with the milligrams. And that's really all we need.
Yep. And Mary, those appointments can also be done remotely, right?
Yes. They are a lot easier in person, because what we do is we pull up on the computer screen the different plans. You can compare them side by side, every little detail. It's very helpful. If you can't get in, we understand that. And what I've done with a few people is I've talked to them on the phone and then printed it and mailed it to them. And then they call back and then we can pick up the conversation. So it is possible to do it on the phone.
Thanks, Mary. Mary's awesome. Sure. I was really excited when I was flipping through to see her there. Thanks for joining us today.
Thanks, Karen.
Any other last minute questions? I think we've gone a bit over, and I
think we have. We want to thank you, though. It was wonderful. I think people got a lot of information.
I'm so happy to help y'all. And I did ask your director, Mr. Lucas Livingston. I have a whole nother presentation about free services that we offer as the area agency on aging. And I would be so happy to talk to you all about that and make sure that you're getting all the things that just by being an older American over age 60, you're entitled to.
Sounds good.
Let's set that up. And I hope you all, your Thanksgiving event sounds fantastic. And please let us know if you have any other questions. I'll put our contact information. Dr. Russo can help. I think our contact slides at the end. There you go. Oh, sorry. There's my information, and there's Miss Mary's on there. And I guess Victoria's not on there. We'll give you Victoria's information too.
We really do thank you so much. It's wonderful. It is information we all need. So thank you. And we have a slide. I think we have a copy of this that people can look at it later if they need more information, because it was recorded. So thank you again so much. And we look forward to hearing from you again, I think, Karen. It's going to be wonderful.
Take good care.